CCA exam questions and answers with explanations, 30 tricky questions. Question 1. Which healthcare setting uses the ICD-10 PCS coding system? Physician offices, inpatient hospitals, outpatient clinics, emergency rooms. ICD-10 PCS is strictly for inpatient hospital procedure coding. Question 2. The principal diagnosis is defined as the first condition treated, the condition established after study to be chiefly responsible for the admission, the most severe condition, the reason the patient came to the ER. Per UD's guidelines, the principal diagnosis is determined after study at discharge. Question 3. Which part of Medicare covers physician services? Part A, Part B, Part C, Part D. Medicare Part B covers outpatient and professional services. Question 4. What is the purpose of an Advance Beneficiary Notice (ABN)? To give consent for surgery, to notify the patient that Medicare may not pay for a service, to list the patient's medications, to schedule a follow-up. ABNs inform patients of potential financial responsibility for non-covered services. Question 5. Which organization maintains the CPT code set? CMS, WHO, AMA, AHA. The American Medical Association, AMA, owns and maintains CPT. Question 6. What does HIPAA stand for? Health Information Privacy and Accountability Act, Health Insurance Portability and Accountability Act, Healthcare Insurance Professional Act, Health Integrity and Privacy Association. Health Insurance Portability and Accountability Act. Question 7. A Charge Description Master (CDM) is primarily used for clinical documentation, capturing costs for every service/item provided to a patient, research statistics, physician payroll. The CDM is a database used by hospitals to bill for all services. Question 8. The term upcoding refers to coding for the highest level of service regardless of documentation, using the most recent ICD-10 manual, sending claims electronically, applying modifiers correctly. Upcoding is a fraudulent practice of billing for more expensive services than performed. Question 9. Which of the following is an example of a soft tissue CPT code? Splinting of a finger, excision of a subcutaneous lipoma, repair of a bone fracture, casting a leg. Excision of a lipoma is a soft tissue procedure. Question 10. In the SOAP note format, where does the physician's diagnosis go? S. Subjective. O. Objective. A. Assessment. P. Plan. The Assessment A section contains the physician's diagnosis and medical reasoning. Question 11. What is the main function of the modifier -59? To show a bilateral procedure, to indicate a distinct procedural service from others on the same day, to report a repeat procedure, to show professional component only. Modifier -59 is used to identify procedures that are not normally reported together but are distinct. Question 12. Which acronym represents the system used to group inpatient hospital stays for payment? CPT, DRG, HCPCS, APC. Diagnosis-related groups, DRGs, are used for the Inpatient Prospective Payment System, IPPS. Question 13. What is the primary key used to link records in a database? Name, date of birth, unique identifier, example, patient ID, address. A unique ID ensures records are correctly linked without confusion from similar names. Question 14. Which entity investigates healthcare fraud and abuse? OIG, Office of Inspector General. WHO, JC, Joint Commission, AAPC. The OIG is the primary agency for investigating fraud within DHHS. Question 15. The alphabetical index in ICD-10-CM should be used to find the final code directly. First, to find a lead term and suggested code, followed by verification in the tabular list. Only if the tabular list fails. Never use the tabular list only. Always verify codes found in the index with the tabular list for instructions/notations. Question 16. What is a V code in ICD-10-CM? External causes, used for vaccinations, vision problems, transport accidents, vascular disease. Chapter 20, V00Y99, covers external causes of morbidity, including accidents. Question 17. Which CPT modifier is used for the professional component of a radiology service? -26, TC, -52, -53. Modifier -26 indicates that only the physician's interpretation, professional part, is being billed. Question 18. The U in UD stands for universal, uniform, unit, unilateral. Uniform Hospital Discharge Dataset. Question 19. What is unbundling? Separating surgical packages into multiple codes to increase reimbursement. Cleaning surgical instruments. Merging two codes into one. Coding for anesthesia separately. Unbundling is the illegal practice of billing separately for components that should be under one code. Question 20. The 3-day window rule for hospitals refers to the time to file a claim. Diagnostic services within 3 days of admission must be bundled into the DRG. The time a patient can stay in the ER. The post-op follow-up period. CMS requires outpatient services 72 hours before admission to be included in the inpatient claim.